Okay, so in this lecture, we're going to go over some of the muscles that are found here on our torso model, as well as the arm model, and go over some of the different ligaments that are found in the elbow, as well as the... So this muscle is the temporalis. Then you have this muscle, which is the sternocleidomastoid. This muscle is the masseter. And this muscle that's here on the back side, this is the trapezius. So the upper trapezius will go and insert or attach to the external occipital protuberance. So what we have right here, this is a cross section of the sternocleidomastoid. And then moving downwards, so this large structure is the diaphragm. And so one thing about the diaphragm is that whenever it's like in a relaxed position, it's in the dome state. So for instance, just like me standing here, it's pretty much in the dome shape. But if I was to go and start running, right, my lungs, they need to expand. And so what will happen to the diaphragm is it'll flatten like this to allow more space for air to come into the lungs. Okay, but anyways, this is the diaphragm. And then here within the thoracic cavity, let's go and identify some of the muscles going outward to inward. So this large muscle that's here on the outside, so this is the pectoralis major. You have the pectoralis minor, which is deep. And then 1, 2, 3, 4, 5, 6, 7, and 8. This is what's known as the serratus anterior. So serratus is Latin for blade. And so the muscles, they sit like this, and they help to stabilize the scapula. So if you watch boxing, what you'll notice is that a lot of the boxers, their serratus anterior is like really prominent. And the reason that it's really prominent is because they're throwing punches a lot. And so the action of the serratus anterior is obviously the first one, which is stabilize the scap. But when you throw a punch, the scapula is abducting. It's going away from midline, compared to if I bring my arm backwards like this, the scapula is adducting. So the serratus anterior is also known as the boxer's muscle. All of these are just cross sections of the ribs. So what's in between the ribs is the intercostals. So costals means ribs. Like even when we say costal cartilage, right, we're referring to the ribs. But the intercostals are here in between, and they're also found here. So these are the internal intercostals. Okay, so moving downward. So down here we have our oblique muscles. So you have external obliques, and then you have the internal obliques. So the external ones are obviously on the outside, and the internal obliques are here on the inside right here. And then the abdominal muscle that's deep to that is this. So this is what's known as the transverse abdominis. And so for these muscles, the way that they're named is based off of the orientation. So the transverse abdominis is in this direction. So that's why if you look at the fibers, they're running parallel. Compared to the obliques, they're at an angle. That's why they call them the obliques, and then we describe it based off of whether it's external or internal. And so the transverse abdominis is going to help to compress some of the abdominal contents, but the obliques, they are helping to rotate the trunk. Right? So if you think about if you play baseball or if you play golf, the motion when you're going into the backswing, right, you're using your oblique muscles to rotate the trunk this way in order to go through the ball. This muscle is known as the Quadratus Lumborum. So this muscle is in the lumbar region, and it's shaped like a quad. Okay, so you can see it there. This is the psoas major and the psoas minor, and this muscle that's on the inside is known as the iliacus. So this is the iliacus. And one other thing that I'll mention about the Quadratus Lumborum is that, so for people that sit a lot, right, if you're especially students, when you're studying a lot, that muscle can get real tight. And so a lot of times it gets stretched. So if you stretch down this way, right, you want to stretch out that muscle that's right there because it can get real tight from sitting a lot. Because what the action of the muscle is it helps to extend the spine. So this is the flexion of the spine, and then this is the extension of the spine. The first thing that we want to do, whatever station that we're at, okay, whether it's an arm model looking at muscles, whether it's the bones, the first thing that we always need to do is what? We need to orient ourselves. You have to know what it is that you're looking at. What is anterior? Is this an anterior view? Is this a posterior view? What part is medial? What part is lateral? By knowing these things, this will lead you to the right answer. So when I look at this arm model, is this an anterior view or is this a posterior view? It's anterior. And so the part, so this side, is this medial or lateral? Medial. This is medial. So that would make that, or this part, the lateral. Okay, so now we know what we're looking at. So this bone is the clavicle. Laterally, this is the acromion. On the posterior side, you have the spine of the scapula. So we're going to look at all the muscles that are attached here. So the first muscle, this large muscle here, is what's known as the deltoid. So you have the anterior fibers in the front, the middle deltoid here in the front, and then the posterior deltoid here that is in the back. The rotator cuff muscles. So the first one that's here, this is what's known as the subscapularis. Sub is below, like a submarine. So you have the subscapularis. And then the one that's above the spine of the scapula is the supraspinatus, right, because it's above the spine. So you have the supraspinatus, this is the infraspinatus, and then this smaller muscle that goes here this way, this is what's known as the teres minor. So you have the teres minor and the teres major, right, because this one is smaller compared to this one. Or the bony landmark that's right here, this is what's known as the Coracoid Process. So if you look at it, you'll see that this is what's known as a tendon. So make sure you're not mixing up tendons and ligaments. So tendons are muscle to bone, ligaments are bone to bone. So this would be a tendon. Yes, so this is a tendon. And so both of these are tendons for the biceps brachii. So you have a short head and you have a long head for the biceps brachii. Just remember that the long head is lateral, which would make the short head medial. So this is the short head, which attaches on the coracoid process, and this is the long head, which attaches on the supraglenoid tubercle of the scapula. So if this is the coracoid, that would make this muscle, which is number 15, the Coraco Brachialis, because it's going to the brachial region, which is the upper part of the arm. This muscle is only in the upper arm, so it's known as the brachialis. So it's a deep muscle. So it's there, and then you can see it laterally here. So this is, it's number 14, that's right there. And then if you look at the posterior side, this is the triceps. So for the biceps, there's two heads, so they call it the biceps. For the triceps brachii, there are three heads. So you have a long head, you have a medial, and a lateral head. So if we look at it this way, this is the long head of the triceps. So which one would this be? The medial or the lateral? Orient yourself. What are you looking at? This is a posterior view. This is the medial border of the scap. Yes, so that would make it, this would be the medial head of the tricep. And then this would be the lateral head of the tricep. So this here is the distal end of the humerus. The first thing that I need to do is understand what is medial, what is lateral. And so I do that by looking at the ulna, because the ulna directly articulates here with the humerus. And so what you're looking at, this is a right arm, because this is the ulna and this is the radius. And so if I know that this is the medial side, I know that both of these are epicondyles. But I know that this one is the medial epicondyle and this is the lateral epicondyle on this side. And so the rule of thumb here for the flexors and the extensors of the forearm is that the flexors are on the medial epicondyle. The extensors are on the lateral epicondyle. The lateral epicondyle is here. The medial epicondyle is here. So based off of what I just said, so let me first point out this. So this muscle is known as the brachioradialis. So let me bring this a little bit closer. So this is the brachioradialis. It's going from the brachial region to the radial side, which is the thumb. So it goes down this way. But then if I rotate it this way, would this be an extensor or would this be a flexor if it's on the lateral epicondyle? Yes, if it's lateral, that means that it's an extensor. And so by knowing this, the names will kind of indicate for the forearms the action of the muscle. So this muscle is an extensor, so it's the extensor. It goes past the carpal bones, so it's the extensor carpi. It's on the thumb side, so radialis, and it's long. So it's the extensor carpi, radialis, longus. So if this is the ECRL, that would make this one the brevis, the extensor carpi radialis brevis. So let's finish the extensors. So looking at number 30, we already know this is an extensor. Because it's right here and you follow it all the way along, it's going to the digits. So it inserts at the phalanges. So if it's an extensor and it's going to the phalanges, this is the extensor digitorum. And then over here, this is what we have, which is known as the anconeus. And then this one, number 32, this is going to the pinky side. So what would be the name of this? It would be it's on the lateral epicondyle, so it's a extensor. And if it's on the pinky side, it's ulnaris. Yeah, so it's the extensor carpi ulnaris. And so by knowing the name, that's what's going to tell you what the muscle is going to do, right? Because it's helping to move the wrist, right, my extensors. Because we already said if it goes past the joint, that's what's going to help to move it. So if the muscle or the tendon goes past the joint, that's the muscle that that's the joint that it's going to alter the movement. Okay, so we did the extensors. Now let's go back to the flexors. So what I look at from this point of view, I look at this little triangle here. So this is what's known as the pronator teres, number, I think that's 21 or 22. But so this is known as the pronator teres. So pronation is when you pour the soup out. So when you go like that, it's pronation. So you have the pronator teres. This is going to the thumb side. It's off the medial epicondyle. So what would be the name of this muscle? Flexor carpi radialis. So flexor carpi radialis. And then this muscle that's here down the middle, this is known as the Palmaris longus. And so if you go like this, so if you kind of make that, you can see the Palmaris longus tendon that's poking out. So this is the Palmaris longus. And then the muscle here that's deep, this is a flexor. So it's going to the digits. So it's the flexor digitorum superficialis. You also have the profundus, which is deep. So then if you look at it from here, this is going to the pinky side. I know that it's a flexor. So it's the flexor Carpi Ulnaris, which is right there. Tendon right here is from the latissimus dorsi. So what you're looking at, this is an anterior view of the scapula or the shoulder girdle. And so it's the same thing with the ligaments. If you know the bony landmarks, then you should do fine. The only thing is just knowing the order of the sequence of saying it. So let's go over the bony anatomy real quick. So this is the clavicle, this is the acromion, and this is the spine of the scapula. So if I know that this is the clavicle and this is the acromion, this would be the acromioclavicular ligament, which is number 1. This is what's known as a plane joint. The only movement that's here, it's gliding against each other. But the ligaments are helping to stabilize. So then now I look at this, which is the coracoid. So if it goes from the coracoid to the acromion, it's the coraco-acromial ligament, which is number 2. So now if I look at here, this is from the coracoid to the clavicle. So both of these make up the coracoclavicular ligament. To get more specific, number 3 is the trapezoid, and then number 4, this is what's known as the conoid because it's shaped like a cone. So then if we look at it from this direction, so both of these are the tubercles. This is the greater, this is the lesser. And so this one that's coming here, number 6, so this is the supraspinatus tendon because it's inserting there. And this one over here is going from the coracoid to the humerus, so it's the coracohumeral ligament. And then the last 2, you have this one in the front and this one in the back. So they're going from the glenoid cavity to the humerus, so it's the posterior glenohumeral ligament, and this is the anterior glenohumeral ligament. The ligaments here in the elbow. So the first thing I do, what am I looking at? I know that this part is medial. So this ligament that's here, this is the ulnar collateral ligament, and the one that's here, this is the radial collateral ligament. They also will say medial collateral ligament, and this one is the lateral collateral ligament. This is the tendon for the biceps brachii. And then you also have the annular ligament, which wraps around the head of the radius. Okay, so one clinical aspect thing that I'll kind of point out. So the ulnar collateral ligament, I don't know if you've heard of the Tommy John surgery. So a lot of time pitchers, if they tear that ligament here in their elbow, the ulnar collateral ligament, what they'll do is they'll pull like the tendon from the Palmaris Longus, and they'll use that and replace it for the UCL. And so just a little bit like history, like why it's called Tommy John. So Tommy John was the first person that received this procedure for getting the ligament replaced. So yeah. All right, so that's going to do it for this lecture. Are there any questions?